my presentation is a lunate dislocation. Anatomy, this usually will affect the surrounding carpal bones around the lunate. So it would be the lunate, the triquetral, the capitate, and the hamate. This will also affect the lunotriquetral, the radioscaphocapitate, and the scapulolunator interosseous ligaments, and then it can affect the radius and the ulna. The pathology for a perilunate dislocation, this is a dislocation of the carpus relative to the lunate, and it will remain normal alignment with the distal radius. Lunate dislocations are very rare, and all the carpal bones stay in place. There's often a volar displacement, which can cause ligamentous injuries or displacement of rotation. Mechanism of injury can be, for a lunate dislocation, fuchsing, a car accident, and it's most commonly seen in snowboarding. And then for a perilunate, it could be a hyperextension with ulnar deviation and fuchsing. Signs and symptoms will be pain in the wrist and palm of the hand, swelling of the hand, limited motion of the wrist and hand, and tingling and numbness of the fingers. Special test is the Murphy sign. The third metacarpal phalangeal joint should be higher, and if it's higher, then that is negative. But if the knuckles are even, then there is a possible dislocation, and that is positive sign. Predisposing factors can be playing sports that lead to a lot of falling, smoking, and having an improper diet. Recognition and differential diagnosis. So the differential diagnosis can be a lunotriquetral ligament instability, scapholunate dissociation, a scaphoid fracture, or a triquetrum fracture. Management and treatment, you will stabilize the hand and wrist, and then you will take them and you will get an X-ray, an MRI, or a CT scan, and then they will often get surgery. Referral and immobilization, you want to refer them to an orthopedic physician right away if dislocation is suspected. The hand and wrist needs to be stabilized before transferring, and the surgery is needed to relocate the lunate. Prevention can be wrist taping or bracing during sports, avoid falling on an outstretched hand, and having proper nutrition. There is no mulligan technique. This is my peacock, and then references.